I'm Thomas Kelly, and I lead ICHOM's work in Europe and Asia, located in London. So ICHOM stands for the International Consortium for Health Outcomes Measurement, and it's an organisation that's non-profit, charitable, co-founded by the Boston Consulting Group, Michael Porter, Professor Michael Porter's Institute at Harvard Business School, and the Karolinska Institute. And as an organisation, we have three simple ambitions. Number one is to develop standardised sets of outcomes that reflect what matters most to people with individual medical conditions. And these sets of outcomes aim to be standardised at the global level so that they can be used by all institutions, with the aim of us having a common global currency around quality. The second thing that ICHOM aims to do is to support benchmarking, which can then take place. Once you have everybody measuring the same things, of course you can compare. And we believe, and what we also aim to support within that benchmarking idea, is the learning that can come from that, so that you're able to learn from those with better results and figure out what it is that they're doing, so that we can translate that to institutions with poorer results. And the third core thing that we aim to achieve, and we're not there yet, but it is an ambition, is to enable complete transparency around outcomes for the benefit of patients, so that they can choose who and where they're treated, and also for the benefit of clinical teams, so that they can compare their results with different clinicians. So of course the word ICHOM, it is an international organisation, and of course, as I've just said, our ambition is to develop globally agreed standard sets of outcomes that all organisations can and ultimately do use. And so by the very nature of everything that we do, it is international. And so by that, in terms of developing these standard sets of outcomes, we develop working groups of people drawn from the world leading centres, so clinicians, patients, from patient advocacy groups all over the world, from policymakers and academics. And if I were to give you an example of that, so for the prostate cancer standard set that we've developed, that working group brings people from North America, from the Middle East, from Europe, from Australia, from Asia, and so therefore it very much is an international group of people that work together with ICHOM to develop these sets of outcomes. And in addition to that, I'd mention in terms of our sponsors. So we, as I say, we exist as a non-profit. We're dependent on our sponsors to survive. And those sponsors come from countries and hospitals and health systems all over the world. Again, from India, from the Middle East, from Australia, from other parts of Asia, from North America and South America. And finally, from an implementation perspective, who is it that's using our work? And if I start here very locally, we have Apollo. We are here, of course, at their conference, and we're working towards use of our sets of outcomes here. Fortis Healthcare, of course, also here in India, using our coronary artery disease work, and Aravind Eye Care System, having played an instrumental role in the development of our cataract and macular degeneration standard set, also implementing those too. And that pattern continues across the planet, with implementation being widespread across Europe, in the UK, in the Netherlands, in Sweden, in Spain, in Portugal, across North America, in Canada and the US, and again across East Asia, in Singapore, in Malaysia, and down into Australia too. Yes, and I of course just began to touch on that, and I think that what I've described so far, of course, tells you about the standard sets of outcomes that we develop and how we do that with the development of working groups. And the second thing I described is then do people use those outcomes, and what happens during the implementation phase. In both of those phases, the standard set development and the implementation, India has been very active. So coronary artery disease, as I say, Fortis was central and was part of that working group for the development of that set. They're now implementing that set of outcomes. The same applies to Aravind. They were central to the development of the cataract and macular degeneration set, and are using those. And the same applies to a local hospital here in Bangalore, the Mahavir Jain Children's Hospital, central, playing a leading role in the development of the cleft lip and palate set, and now implementing it. Likewise, from a patient perspective, as I mentioned at the beginning, patients and carers are central to all of the working groups that we develop. And again, for cleft lip and palate, we had a family, two parents on our cleft lip and palate group from Bangalore, representing their son, who was 2 years of age at the time, with a cleft lip and palate. That, I think, is a summary, at least, of how we go about engaging India. Yeah, no, I think it's a very, very important question. And I think what we have seen and what you've heard from earlier interviewees is that what we have to do in healthcare is we have to focus on the results that matter to patients. That's why we're in this business, that's why we're in this industry, and therefore we have to measure those things. Now, once we've measured those outcomes that really matter to people, then of course, as individual institutions, we can see how we're doing, and we can see if we're actually achieving what it is that matters to people, and if we're not, then we as individual institutions, it empowers us to figure out internally how is it that we can improve. And of course, if you don't measure something, you can't possibly improve it. So measurement is the first step in working towards improvement. That's the first thing. Simply measuring outcomes is a way to figure out what you're doing well, what you're not doing well, and therefore it is a stimulus to sort out what you're not doing well so that you can improve it. Now, that's the first thing. The second thing, of course, that is then important, as with any industry, whether it's education, whether it's healthcare, whether it's defence, international collaboration can be very, very valuable. Working with others, the more people that you can work with, the more people from whom you can learn, the better. And so by having a global currency and by having a standard set of outcomes that we have institutions all over the world measuring, then instead of just looking at our results internally, we're able to look at and compare our results very, very broadly. And what that then means is we can say, why is it that Hospital X in the United States is doing better than Hospital Y in the UK? And why is it that, in fact, both of those hospitals are doing slightly better than us in India? Because then what we can do is we can see what they're doing well and try and translate that to here. But at the same time, what it does is it also potentially puts India in a leadership position, because it's entirely possible, of course, that what India is doing is achieving better outcomes than what's actually happening in the US and Western Europe. And so India can benefit from this in terms of improving its quality of care, but what it can also do is it can actually showcase to the world how well it is doing and help other countries also improve their quality.